5 years old being diagnosed with heart disease. So clearly, these plant phytosterols are toxic for us. They cause problems. Was that when they removed saturated fat from the diet and put seed oils into the diet, the risk of dying increased by 6%. In essence, it's understanding that there is a lot of similarities between a demented brain and a concussed brain, and ketones can be useful for both.
Welcome to Chief Life, the podcast that cuts the crap with science-backed insights on health, nutrition, and performance. Get expert advice, actionable tips, and everything you need to take control of your health and live your best life. Let's get started. In today's episode, we will chat to a top sports physician about the hottest topics and new research in the world of nutrition. We will dig deep into seed oil, saturated fats, dairy, the impact of insulin on a brain trauma, new methods in sports nutrition, and more. Dr. Paul Mason is a fellowship-trained sports and exercise medicine physician with degrees in medicine, physiotherapy, and occupational health. He is renowned for his expertise in medical nutrition therapy, particularly in low-carb, ketogenic, and carnivore diets. Dr. Mason regularly lectures both in Australia and internationally, advocating for nutritional interventions in conditions such as diabetes, dementia, concussion, and autoimmune disorders. As a sports medicine specialist, he consults with elite athletes and professional sports teams, while also maintaining a strong academic interest in chronic pain. His involvement in the low-carb down under movement cemented his reputation as a nutrition and lifestyle management thought leader. True to the Latin roots of doctor, meaning teacher, Dr. Mason prioritizes educating his patients on their treatment options, focusing on a holistic approach that emphasizes lifestyle changes over pharmaceuticals where possible. Hi, Paul. Thank you so much for coming onto our podcast.
Thank you. It's great to be here.
The whole team is super excited to have you on. We've been following all your work and we really love what you do. And as a first question, I'm really keen to know, how did you get into nutrition? Because you're a sports physician, but your public talks are mainly about nutrition. So when did you start showing interest in nutrition, and why? Did you study any extra nutritional courses or anything like that?
Well, I think the blame for that has to rest at the feet of Professor Peter Bruckner and Professor Tim Noakes. So, as you know, they're both highly regarded sports medicine physicians, and they wrote an article in the British Journal of Sports Medicine some time ago now, probably 15 or more years, about 15 years ago, I suspect, and that talked about the management of diabetes and low-carb diets and high-fat diets and so on and so forth. And I was a junior doctor then. I was quite diligent, and I had the medical journals there, and I was reading it on the couch one night, and I saw this article, and I thought, wow, well, that's nonsense. I mean, I've gone to medical school, and I know how bad fat is, and I know that carbohydrates are good, and this just doesn't make any sense. So I said, that can't be right. And then I went and had a look at some of the references, and because I knew Peter Bruckner and Tim Noakes, and I understood they had immaculate credentials in terms of their academic prowess and being evidence-based on and so forth. So I probably didn't dismiss it quite as readily as I might have if I didn't actually respect those two authors. And I went to the references, and I was like, oh, and I started thinking to myself, there might even be something in this. This is quite odd. And understand that this was really quite confronting, because I thought I knew everything about, cholesterol and fat and so on and so forth. And that just really opened my eyes. So over the next few years, I sort of just continued this exploration. I read Gary Taub's book, Good Calories, Bad Calories, so on and so forth. And then I did a lot of literature searching myself, and just over the next several years, I guess I developed just increasing awareness of the importance of diet and the fact that what I thought I had been told was actually not true. So I remember when I was a resident, there was this lecture by Robert Lustig called Sugar, the Bitter Truth. And at that time, it had had like maybe 2 million views, which is probably over 15 or 20 million views now, however many. But back then, that was a lot of views. And it even got a mention in a New Scientist article that I was reading. And I remember on night shift with some other residents, we were sitting there watching this 2-odd-hour lecture on all forms of liver biochemistry and so on and so forth, and we were absolutely flabbergasted to say, well, maybe all of these things, fatty liver and so on and so forth, maybe it's the sugar. And that was just part of the journey, and over time I sort of, it influenced my practice. I still remember when I was on a general practice rotation, which is like family medicine, and a mother came in with her children, and the child was sipping a 600 ml bottle of Coca-Cola. We called them the Buddy Cokes back then. That was some time ago. And I made some comment, because in my new knowledge about sugar, I was like, probably along the lines of, I wouldn't be doing that if I was you. You know how bad that is. And rather than getting upset, the mother was incredibly grateful, because she actually had, I think, an instinctual awareness that her kid having that sugary drink was not good for the child. So she actually made him put the cap back on it and drop it in the bin right in the room. And she was really pleased with that. And I think that was quite a meaningful thing to me, because I actually felt that whatever the consultation was that day, that I had probably done more for that child's well-being across their lifespan with that small intervention. And it really struck me how simple it was and how powerful that intervention could be. And obviously my knowledge has expanded many-fold since then over the last 10 or 15 years, and I've just been constantly learning and reading. But that was really how I got into it in a professional sense. That was really what gave me visibility that these things could be useful. And certainly from a personal perspective, it transformed my own health. I mean, I used to be having what was technically termed metabolic syndrome. And I'd like to think now that, 10, 15 years later, that I'm in much better health than I ever was when I was in my 20s and 30s. And so it's been a benefit to me both professionally and personally.
That's amazing. And where do you normally search for information? I usually search on PubMed, but is there anywhere else where I can find the good science information?
It really depends on level of scientific literacy, and the reason is, so I used to do PubMed exclusively. Now PubMed is, once you've found a paper on something, PubMed is fabulous to go down the trail of breadcrumbs. They've got down the bottom, so PubMed is, as you know, it's a free repository of scientific articles. I believe it was founded by Hillary Clinton, for better or worse.
Really?
But anyway, that's an aside. But I mean, I actually really like the notion of PubMed. And it's got articles cited by this article and similar articles. And I find that's a really convenient way. Once you've located an article on a topic of interest, then the cited by articles and the similar articles that's built within the PubMed searching is a nice way to just get a little bit more depth on the topic. Now, I do sometimes also like just a general internet searching, but you have to be more mindful, and often you'll come across things that maybe aren't listed, they're not indexed by PubMed, and I'll often find information that I consider quite valuable that's not technically in the formal official literature that bears some research. But you do need to be able to sort out the wheat from the chaff with that. And there's a lot of nonsense out there on the internet, and that's where it becomes the level of interpretation, the ability to discern between something that's biologically plausible and something that's complete nonsense. So it really just depends on your comfort level in terms of doing that. But having said that, even if it's in the published literature, even if it's through PubMed, you still have to be incredibly sceptical about a lot of what you're seeing, because a lot of what is listed there is complete and utter nonsense. And I've actually got a lecture that I gave in San Diego a couple of months back, where I talk about the problems with literature and how do you as a layperson actually interpret literature and figure out whether it's a whole lot of bollocks or whether it actually makes sense. And hopefully this lecture will open the conversation about educating people so that they can push back against some of the, I guess, more conventional advice that they're being given when it's patently absurd.
Yeah, that's amazing. If you have a link to the webinar, could you send it to me and I'll attach it to the podcast, because I think everyone...
I don't think it's actually gone online yet, so that will eventually go up on the Low Carb Down Under YouTube channel.
Okay.
But there's usually a process that was done at the Low Carb USA conference, so I'm not exactly sure. I'm actually not in charge of when they get released.
Well, I'll look out for it. That's really interesting, and I think it's really important because people don't know how to read those things, and that's how lots of misinformation arises. But
it's also people understanding that this is not just accidental misinterpretation. And a lot of the ways these papers are written, it appears as though they've been written with the deliberate attempt to obfuscate the true findings.
Unfortunately, yes. But I wanted to ask you, do you still send your athletes to sports dietitians or nutritionists, or is the nutrition plan part of your treatment now?
To be fair, I never did.
You never did? Okay, so you do everything. That's great. I kind of knew it, but I just wanted to confirm. Okay, so let's get into some of the controversial topics that I want to talk to you about that are controversial or people are not really clear on it. Let's talk about fats first, and especially seed oils, because they have become very controversial topic. Can you please explain to us why exactly are seed oils harmful to our health?
So there's three things that really stand out that we need to talk about in no particular order. So one of them is the omega-6 content. One of them is something called oxidation products or oxidation stress. And the third is called phytosterols. And I guess there's a fourth element here, which is that seed oils actually also impact on your blood glucose levels. And we'll talk about how they do that. So this, as you know, this is a huge topic. So first of all, a bit of a mea culpa. So I previously have criticised seed oils solely on the basis of their omega-6 content. Then when I learnt a bit more, then I criticised them largely on the basis of their oxidative stress, the oxidation products they contained. However, more recently, it seems fairly clear that there's another element to their toxicity which is probably even more important than the first two, and that's due to them containing in relatively large amounts a plant cholesterol analogue. So it's a plant cholesterol, we call it phytosterol, and it's like human cholesterol but not exactly. It's close enough to human cholesterol that it can be absorbed into our body and taken up into our cells, but it's different enough that it doesn't work the same, and that leads to some toxic side effects. So let's talk about this whole notion of omega-3 and omega-6, and I might just take you on my journey of why I thought the omega-6 fats were so bad. And this is the very first, the most common mistake that, ironically, I've criticised a lot of other people for making. It's mistaking correlation for causation. I think this is clear proof that I fell for exactly the same trick. You see, we've got some research that looks at levels, we call it the omega-3 to 6 ratio. So omega-3 is the type of fat that you largely get from fish oil, for example. Omega-6 we get from seed oils, largely, but that's a simplification. Number one, they're both essential fats. So if you don't have them, you'll get very sick. So they're both equally essential. You don't need more 6 than 3 or 3 than 6 of what they're necessary. Now, there's something called the omega-3 to 6 ratio. So we know that the ratio you consume in your diet will be reflected in the levels of fat in the red blood cells. And we can do a test and we can look at the ratio of 6 to 3 in your red blood cells, and that will tell us about the kind of foods you're eating. We also know that when we look at the omega-3 to 6 ratio, that it is hugely predictive of all sorts of ill health, your risk of having a cardiac arrhythmia, your risk of dying from a heart attack, so on and so forth. We understand, and we're talking like a factor of 10. So people with the best ratios might have 10 times less risk of heart attack, than people with the worst ratios. So hugely compelling. However, it is only associational, and that's a mistake I made. I looked at this and I thought, well, clearly people with more omega-3 are doing better when we look at this population-based data. I'm going to discourage my patients from having omega-6, and I'm going to encourage them to have omega-3 rich foods. Now, incidentally, that's actually the right thing to do. Unfortunately, I didn't end up giving my patients bad advice based on this, but I truly believe that it was the omega-6 which was actually toxic. And then later on, there was a study that looked at people on low-carb diets and low seed oil diets, and that actually found that people's level of arachidonic acid, which comes from omega-6, actually increased on low-carb diets. And it's like, how can that be? We've assumed that omega-6 is bad because it produces arachidonic acid, and arachidonic acid leads to inflammation. So it just didn't make sense how arachidonic acid levels could increase on this low-carb diet. Now, the reason is because the omega-6 and the arachidonic acid is not inherently inflammatory by itself. It needs an inflammatory trigger. And only when it's had that inflammatory trigger will it produce these nasty downstream chemicals like leukotriene and so on and so forth. So if you're in a low inflammatory state, if your body doesn't have these inflammatory triggers, the arachidonic acid will just sit there, and it won't cause you burning or pain or swelling or what have you. And that also explains why the arachidonic acid level might increase on these healthy diets, because you've actually got less inflammatory triggers, so the arachidonic acid isn't turning into these inflammatory components, it's just sitting there and accumulating. So that was the very first visibility. I thought maybe I need to reevaluate my thought process that omega-6 fats are inherently inflammatory, because this study speaks very much against it. And I was also, about this time, I was developing some visibility about the harms of what we call oxidation. So when we say oxidation, when a piece of metal is in the rain and it rusts, that's what we call oxidation. That's oxidation stress. From a chemical perspective, it's what happens if you've got an electron orbital with a valence shell and you take away an electron out of that. That's what oxidative stress is. But this also happens in the body to our molecules. So our bodies are constantly defending themselves against oxidation. It's just unfortunate that our bodies survive on oxygen. So there's inherently, by design, we actually need to defend ourselves against this level of oxidative stress. And we know that seed oils, because of their bonds, these what we call the polyunsaturated bond, which is you have two carbon atoms and they've got two bonds between them. They're very, very reactive, and they can oxidize easily. Now, the problem with these oxidation products is that we can consume them. So you have vegetable oil, that's oxidized in the bottle. You consume it, it gets taken up, it enters your bloodstream. And it does all sorts of things. You would have heard of small dense LDL, which is the damaged LDL. Well, one of the ways to damage it is with oxidation. So consuming seed oils with all their oxidation products is not necessarily a good thing. We've actually done studies where we get people to drink an oxidized oil, and in an average person, we can see it in their blood for 8 hours after they consume it. But here's the thing, what happens if you're a diabetic with poor sugars? Then we could actually detect it for 9 times longer, up to 72 hours or 3 days in the blood. So this oxidation component of seed oils is absolutely a part of the reason why they're deleterious, and far more significant than just their content, they contain omega-6 fats. Well, omega-6 fat is not inherently inflammatory, it's actually an essential fat. Without it, you'd get very sick. But then there was a third element, and I first got awareness of this. There's a condition called cytosterolemia. And this is a condition where people absorb a plant analog cholesterol called phytosterols. And one of those phytosterols is called cytosterol. That's why we call it cytosterolemia. Now, normally, our body can understand that this cholesterol, this fake plant cholesterol, is toxic, and it rejects most of it. It still ends up absorbing maybe 0.5 or 1% of it, but most of it gets rejected. But people with this condition, cytosterolemia, they absorb large amounts. They might even absorb 15% or even more of what comes in, and that gets incorporated into their cells. And people with this condition, cytosterolemia, they are known to have severe premature atherosclerosis. There's even cases of children as young as 5 years old being diagnosed with heart disease with this condition. So clearly, these plant sterols or phytosterols are toxic for us. They cause problems. And when they've done biopsies on atherosclerotic plaques, they're saying, well, this is a clogged artery. We do a bypass graft, we cut out the, we'll bypass it with a vein, but let's just take a sample of this one. And when they've done that and they've looked at it under microscopes, they've actually found that these phytosterols are actually embedded within the atherosclerotic plaque. So there's a lot of lines of evidence that will indicate, and I've got lectures on this online, about how these phytosterols can be toxic. And it's my current belief that the deleterious effects of seed oils largely come from these phytosterols, with a significant contribution from the oxidation. But the omega-6 content in and of itself, I don't believe is that much of a problem.
Okay, that's a great explanation. I also wanted to ask you, is that true that when you replace saturated fats in a diet with seed oils or any unsaturated fats, it reduces longevity? And is there any study proving that?
Well, I think the first thing to talk about is what's actually happening with the red blood cells. We know that red blood cells have more cholesterol in them than any other cell in the body. So they're taking up cholesterol very readily. And they also take up these phytosterols very, very easily. Now, red blood cells, they have to squeeze through tiny spaces, so they have to be deformable. They have to have a degree of elasticity, and they don't, if they're too brittle, they'll rupture and they'll die. That's not very good for a red blood cell. Now, we've got clear evidence that the red blood cells will become fragile and basically won't last as long. They'll basically self-destruct when you consume more phytosterol. The higher the phytosterols in a red blood cell, the more fragile it is, the more likely it is to turn over. And that's not an ideal state of being. So in terms of that's what can happen at a cellular level, so absolutely that evidence is clear. But what about the whole organism? What about the human? So we've actually got some very good studies that actually do show that when you increase the vegetable oil content in the diet, that your longevity is reduced. You die more. So we've got 3 large-scale randomised control trials, all of which have been somewhat misrepresented in the literature, but when we actually get down to the truth of it, we actually look at the actual data. The data shows that seed oils increased mortality. So we've got the Sydney Diet Heart Study, which was a study done on males who had heart attacks in Australia, Sydney obviously, where I am right now. And what that actually showed was that when they removed saturated fat from the diet and put seed oils into the diet, the risk of heart attack increased, or the risk of dying increased by 62%. And for whatever reasons, that data was never originally published. It had to be uncovered and so on and so forth. Then we've got the Minnesota coronary experiment. That was several thousand people in institutions where they removed saturated fat and gave them seed oils. And again, well, it successfully lowered their cholesterol level, but unfortunately it did so at the expense of killing them. So the more you lowered the cholesterol, the greater the rate of death. And then you've got the Women's Health Initiative, which is a large-scale randomised controlled trial, 48,000 females over about 8.1 years. And they found again that when you remove the saturated fat from the diet and replaced it with seed oils, that the only significant finding of the whole study, that those females who reduced their saturated fat, they had an increased risk of things like heart attack, about 26% higher. So we've got, and there's one more study that predates all of those. It's called the corn oil study. It's by researcher Rose. It was published in 1965. And that demonstrated a trend, and I can't remember the exact numbers, but there was a higher numbers of death in people when they were put on corn oil supplement than when they were just having their regular saturated fat. So yes, we actually do have, to the best level of evidence, which we've got large-scale randomised controlled trials, actually does demonstrate the deleterious effects of consuming seed oils. And there is no equivalent quality study, a good quality methodology, any randomised controlled trials. There is no study ever published that demonstrates the opposite.
Yeah, this is great because there's so much misinformation around seed oils, and I'm glad that you clarified it for us. I have the next few questions about insulin, and you don't need to answer this next one too much in detail, but I just wanted to ask, does insulin shut off fat burning, and can you quickly explain how it works?
So absolutely it does, yes. But it's not so much that it just shuts off fat burning, it turns on fat storage at the same time. So in the body, we imagine a fat cell is like a balloon, and you've got some fat in the bloodstream in the form of fatty acids or triglycerides, and you've got some glucose in the bloodstream. And the way we have fat in the blood, you would have heard of something called triglyceride. Now, a triglyceride is a chemical, a glycerol background and 3 fatty acids attached to it. And that's got 4 things lumped together, and that's too big. That's too big to get into a fat cell. However, insulin can activate an enzyme that chops it apart and allows the fatty acids to get into the fat cell. So without insulin, the fat doesn't get inside the fat cell. With insulin, the fat does get in there. Now, once the fatty acids are in there, you've also got something called the glucose needs to get into the cell as well. And insulin also helps with that. And then when it's inside the cell, these can coalesce and form the stored version of fat. Now, for the fat, though, if you wanted to burn the fat, you have to leave the cell, so you have to snip this triglyceride molecule back up again before it can leave the fat cell. And there's an enzyme that will do that, and insulin stops that enzyme from working. So on one side of the equation, insulin allows the fat to get into the cell, and on the other side, insulin stops the fat from leaving the cell. So absolutely by effect, and these enzymes, they're called lipoprotein lipase and hormone-sensitive lipase, and by its impact on those 2 enzymes, insulin absolutely increases fat storage and inhibits fat burning.
So as much carbohydrates and as more often we eat carbohydrates, as more we store fat and shut off fat burning, pretty much, in a simplified.
Well, so under what you're referring to there is a tendency for carbohydrates in the diet to release insulin from the pancreas. And as far as, that's effectively true. So eating carbohydrate will release insulin, and that insulin will then turn on fat storing and stop fat burning.
Okay, great. Yeah, I love all this because all these topics are very controversial, and especially amongst all different health and fitness professionals. They sometimes try to tell us otherwise, and I'm glad that we're talking about this and clarifying it for everyone. The next question about insulin I have is relating to brain trauma. Can you please tell us about your research on treating concussions with ketogenic diet? And just in a nutshell, how does the relationship between insulin and brain works?
So the thing about the brain is it's 2% of the body's weight, and it uses 20% of the body's energy. It's an energy fiend. It's so hungry for energy. So because it's so metabolically active, that makes it very vulnerable to metabolic disease. And that's why we now call dementia, for example, type 3 diabetes. Now, what that means is, when we look at conditions like diabetes, we have a condition called insulin resistance, where insulin doesn't work normally. So one of the jobs of insulin is to help sugar get into cells, to help glucose get inside cells. And in dementia, we've got this level of insulin resistance where the insulin's not working properly, so brain cells or neurons that require glucose, they can't get the glucose. The glucose is knocking on the door, but it can't get in. So you end up with an energy deficiency. These neurons are starved of energy, so they can't work properly. And that's what we see in dementia. We see basically areas where the brain is not functioning properly, malfunctioning, what we call underfunctioning. Now, interestingly, is that when we get concussed, that causes insulin resistance as well. Now, you can cause insulin resistance over a long time. You can actually damage the functioning of the insulin receptors with both seed oils, these phytosterols, these chemicals in seed oils, or with a product produced by your liver when you consume too much sugar. They're called ceramides. Now, both phytosterols and ceramides can actually stop the insulin receptor working properly. So you can get insulin resistance from diet, or a sudden concussive impulse can cause insulin resistance very quickly. It will actually, the insulin receptor is very complex, and it sits in a part of the cell membrane called a lipid raft, and it's vulnerable to traumatic damage. So seed oils and excess sugars will damage where the insulin receptor sits, but so too will a sudden concussive impact. So we actually have regions of the brain that end up being starved of glucose immediately after a concussive injury. And then unfortunately, because of that, we have failure of things called iron pumps and so on and so forth. And this energy deficiency actually leads to a large amount of oxidative stress happening within the brain. And that oxidative stress then results in even more damage happening to the brain. Now, fortunately, we can actually take a lesson here from dementia. So we know that people with dementia tend to have brains that are resistant to insulin, so they can't use glucose normally. But there is an alternative. There's something called ketone bodies, or a ketone, which is an alternative form of energy that can be used by these brain neurons, and it doesn't need the action of insulin. So all we have to do is to provide you with ketones, and then your brain's, those cells which are not working properly, they can suddenly start to work again. So the big problem with concussion, though, is that you'll recall that I said you get that oxidative damage, and that happens in the hours after a concussive injury. So if we can somehow find a way to provide those cells with damaged insulin receptors with a ketone supply of energy before that oxidative damage occurs, then we can potentially ameliorate this second wave of damage from concussion, and we can facilitate your recovery from the concussion. So in essence, it's understanding that there is a lot of similarities between a demented brain and a concussed brain, and ketones can be useful for both. Now, the problem obviously is that this damage happens within hours, and if you were to start a ketogenic diet, it takes probably about 4 days to get therapeutic levels of ketones in your blood, and that's obviously, the horse has gone bolted already then. So realistically, you probably need to be on a ketogenic diet before you get concussed, or potentially you need to be taking lots of ketone supplements.
Okay, interesting. So what if someone has got the post-concussion syndrome, like 6 to 12 months later after the concussion, they still have the symptoms? Would ketogenic diet help them?
So there hasn't been a lot of research there on that, but there is one paper that's been done on prolonged symptoms of concussion, and they certainly found some improvements there. So the evidence, as early as it is, would suggest that yes, there is absolutely benefit there.
That's great. It's really good to know for a lot of my athletic clients. Next question I have is about dairy. I heard you say that dairy can contribute to insulin resistance even on a low-carb diet, and that dairy is similar to morphine. Can you please explain that to us?
So what is the job of dairy? We want to take a young animal, we want to make it grow big and quick and fatten it up. So dairy has a reason for wanting to stimulate insulin, because insulin is actually the hormone of growth. It's not just helping fat tissue get bigger, it's also important for muscle tissue as well. It's why some bodybuilders have previously injected, they probably still do inject with it. So insulin is an anabolic tissue. So dairy actually serves that effect very nicely. So dairy actually does induce a degree of insulin resistance, which is actually good for growth. The thing is that we shouldn't be consuming dairy into adulthood, and it's also arguable about whether we should be consuming dairy from other species. It's not something that humans are necessarily adjusted to being able to deal with. Now, when we talked about the morphine effect of dairy, so here's the thing. So we want young animals to grow big very quickly. So to a degree, we need them to overconsume. We need them to put more energy in than they're burning. So we need to make it as delightful, delectable as we possibly can. Now, a lot of people are surprised to know that dairy contains a version of morphine which is even more potent than morphine itself. It's called beta-casomorphine. And if you tell your doctor this, they'll be shocked, and they'll do a little internet search and they'll bring it up and they'll go, oh my goodness, I had no idea. So, and this is, for some people, this is a problem. So obviously morphine infers an addictive potential, which it's in sort of short circuit the body's natural desire to restrain eating and sort of just hack that. It can also cause allergic type reactions. So some people will take a medication if they have autoimmune inflammation. They'll take a medication called naltrexone. So the therapy is called low dose naltrexone. Now, naltrexone is what we give to people when they have a heroin overdose, for example, because it blocks the action of morphine. And if somebody's stopped breathing because they've taken too much heroin, then it'll reverse that and they can start breathing again. Now, low-dose naltrexone obviously is having anti-morphine type effects. So I suspect that the people who benefit from taking low-dose naltrexone, all it is, it's just antagonising the morphine that they're likely getting from the dairy. And we also see that some people will say that dairy is incredibly constipating. And yep, that's absolutely a story that a lot of patients tell me. And we also know that opioids are very constipating as well. So when I was a junior doctor, we had a saying, the hand that writes the script for the opiates also writes the script for the laxative. Because we just know that if you give them the opiate and you don't give them the laxative, they're going to develop constipation. So certainly dairy does contain a form of morphine, beta-casomorphine, and that appears to have some problems for some people. And it likely explains partially the addictive tendency of dairy as well as its constipating effect on some people.
Yeah, and so you don't think people should consume dairy at all, not even fermented dairy like kefir and things like that?
Oh, I didn't say that. So it's all very individual. So there's no such thing as a one-size-fits-all diet. We know that most of the world is actually lactose intolerant, so they shouldn't be consuming dairy with sugars like milk in them, the lactose being a sugar and not being present in cheese and cream and things like that in any significant amount. But for some other people, dairy can be associated with autoimmune inflammations. So my feeling is that most people would be better not consuming dairy. But it's certainly true that some people can consume dairy and get away with it, and sometimes it's even on a scale. So some people might have butter, which is mainly fat. Some people might say, well, I react to butter, but if I have ghee, which is clarified butter, which is even more fat and even less protein, that's fine. Some people, we know that fermentation actually does reduce the effects of some inflammatory proteins, and some people tolerate yogurt much better than they do, other forms of dairy. But there's always, there's nuance to it as well. So if you're making your own fermented yogurt, that's one thing. But if you're buying yogurt in the store, if you have a look at the ingredients, you might see that it's got a culture and so on and so forth, and then it's got added milk solids. And often what they do is to get the fat content up after fermentation, they might add some unfermented, fat back in, fat solids or milk solids, and what you're basically getting is then, you're losing the benefit of any fermentation. And also some people with fermented foods, they might react to yeast. So when we do testing looking for reactivities in people's blood, we often see they have antibodies or immune proteins that react to yeast. So, yogurt might be problematic. It might reduce some of these dairy protein products that are causing problems, but they might be introducing some traces of yeast that they might react to. So there's certainly no such thing as a one-size-fits-all diet, and you can test for it. And I'm of the belief that most people don't need dairy. Certainly you don't need dairy to get your calcium. You can get calcium from other sources, and that's the big thing. There's actually some epidemiological data that finds an association of perhaps an increased incidence of osteoporosis in cultures that consume the most dairy, which is quite surprising given that we're led to believe it's the only possible source of calcium. But that's by the by. So dairy, I think, if most people are consuming it, they should consume it because they love the taste. It's important to them. It might be culturally important, so on and so forth. I don't think there's any particularly good health reasons why you need to consume dairy. But having said that, if you can consume it without any adverse effects, then it certainly is delicious.
Okay, so but if we do consume dairy, it needs to have, let's say, yogurt needs to have only milk and live cultures, and that's it, no other additives.
If you were, well, this point is, if you were trying to reduce or improve your tolerance to dairy by having yogurt, then make sure it doesn't have added milk solids, which defeats the point of the fermentation process.
Okay, great. That's great information. One more thing about the dairy quickly. Some people actually experience measurable improves in health outcomes when they start eating dairy. Do you think it's only because they're replacing junk food with the dairy, or it can be another reason? Can it be another reason?
I haven't actually met any of those people, so I haven't actually been able to interrogate them to see what other changes they're making in the diet. So it's a bit difficult for me to say, but I would presume, so often we see, for example, when people make dietary change, they go to a vegetarian diet and they feel that their health is getting better, then certainly in those situations it's very likely that it's due to the elimination of problematic foods rather than anything else that's going on.
Yeah. One more thing about the dairy. So we're so indoctrinated thinking that we need dairy for calcium. What would be your top food to have for calcium instead of dairy?
Look, well, I think sardines, small fish with the bones inside, is fabulous. I'm not much of a fan of people who talk about crushing up eggshells and stuff like that. That just seems a bit of a step too far. So if you really wanted to get a good load of calcium in, then sardines.
Great, thank you. Next question. You said, or I heard you say that vitamin D is natural sunscreen and people on carnivore diet don't burn. Can you explain this?
So I have never said that people on carnivore don't burn. So they do. They do have an increased resistance to burn, and the mechanism for that is that the vitamin D molecule is just the right size to absorb ultraviolet B radiation. And ultraviolet B radiation is the one that damages DNA and actually causes the reddening and the painful sunburn, basically. So if we actually have a look at phytoplankton, we can see that they synthesize vitamin D, and that appears to be to protect themselves from damage from the sun. Now, vitamin D, as you well know, is produced from cholesterol. So having better cholesterol stores actually facilitates your body to produce more vitamin D on sun exposure. So Ansel Keys actually did some research. He was of the 7 countries study fame and some terrible science. So he actually found that people who were exposed to more sun actually had lower cholesterol levels, which seems to support this. What we now know is that cholesterol is actually used to produce vitamin D. So if you're in the sun more, then your body will have to produce vitamin D to protect yourself from the sun. It will try to do that, and it will deplete your cholesterol stores as it does so. This also explains why people with dark skin don't produce vitamin D. The reason is that they have a chemical called melanin in their skin, which also is great for absorbing ultraviolet B radiation. So they simply don't need to produce the vitamin D because they've got this natural pigment in their skin that affords them a natural degree of sun protection from UVB to begin with. Notably though, this doesn't make one immune from sunburn. So dark-skinned people, they can still get sunburn. People on carnivore diets absolutely can still get sunburned. You will be more tolerant to the sun. You won't get burnt as readily, and I can certainly speak to that. But if you spend too much time in the sun, especially at the wrong time of day, when the sun is closer to being directly overhead, when the ultraviolet B radiation is strongest, then yeah, you will get burnt. So my advice is, and I truly believe in the health benefits of the sun. We've got some very good evidence that in Denmark, for example, they did a study where they looked at people, and it was a whole country study because they've got a national electronic medical record. So anytime anybody gets a diagnosis of skin cancer, they can track that through the whole country. And they found that people who had diagnosis of sun-related skin cancers, basal cell carcinoma or squamous cell carcinoma, on average, they lived about 10 years longer. Now, that's not to say that skin cancer makes you live longer, but almost certainly that's because the skin cancer is acting as a surrogate marker for sun exposure. And when we actually look at the science, the strongest evidence appears for benefit from sun exposure appears to be from ultraviolet A radiation through something called nitric oxide, which is when your body gets exposed to ultraviolet A, it makes a chemical called nitric oxide that has benefits with regards to regulating the immune system, as well as helping lower your blood sugar levels and stabilising your blood pressure, so on and so forth.
Amazing. That's so interesting. And I would love to ask you so many more questions, but I'm very aware of your time. I want to know the last thing, if you would be willing to come on our podcast again and do a second episode.
Well, absolutely.
Okay, I'll talk to you about it later. And also one last question. If you could give one health advice to our listeners, just one, what would that be? Maybe we think about it.
I think it's just be natural. And the more I practice and the more I learn, the closer to a hippie I become. So, these people who used to try and avoid chemicals and eat organic food and so on and so forth. And to be fair, they used to be mocked in society. And the older I get, the closer I move to that natural style of living. So I think it would just be as natural as you can.
I love that. Thank you so much for your time. That was excellent, and I can't wait to have you on again.
Fabulous. Really appreciate you having me.
Thank you for listening. I hope you enjoyed this episode. If you want to hear more from Chief, please like and follow us on Apple Podcasts, Spotify, and YouTube. Comment below to let us know what topics interest you, and you can find us on wearechief.com.